Dizziness on Ozempic or Mounjaro does not always mean an emergency. Most of the time, it means your body is running on less food, less fluid, or both. The tricky part is that the shot gets blamed first. In many cases, the real problem is the gap between how little you feel like eating and what your body still needs. That is why the symptom can feel confusing at first. You may feel fine for hours, then suddenly feel lightheaded when you stand, walk, or try to focus. People often assume the drug itself is directly causing damage. More often, the medicine lowered appetite and slowed how fast the stomach empties, then daily habits failed to keep up. The first useful distinction is simple. Dizziness is a signal, not a diagnosis. These drugs cut appetite and slow how fast food leaves the stomach, so intake can fall before people notice it. That can lead to low fluid, low fuel, lower blood pressure, or blood sugar trouble in the wrong setting. I'm Dr. Kim, a licensed physician. This is not medical advice. Consult your doctor. Here is the basic reason. Ozempic, which contains semaglutide, and Mounjaro, which contains tirzepatide, lower appetite, and slow how fast your stomach empties. Food sits longer, fullness lasts longer, and people often eat less without planning to. When that shift happens quickly, calories, fluid, and salt can all fall before a new routine is built. That shift creates the setup for lightheadedness. A person may skip breakfast because hunger is gone, drink only coffee, eat a late lunch, and stay busy all afternoon. Then they stand up and feel dizzy. The shot may have started the chain, but the immediate trigger is often low intake, dehydration, or a blood pressure dip. There is also an important split in patterns. One group feels dizzy mainly when standing up, walking, or changing position. That often points to low body fluid or low blood pressure. Another group feels shaky, sweaty, weak, or suddenly foggy after long gaps without food. That pattern raises more concern for blood sugar trouble. Those two patterns can overlap, but they should not be treated as the same story. Position-related dizziness is often a blood flow problem. The body does not have enough fluid and blood pressure to keep blood moving to the brain smoothly when you change position. Food-related dizziness is often about eating too little. That matters even more in people taking diabetes medication that can push blood sugar lower. Many people interpret the symptom the wrong way. They think feeling less hungry means they are finally doing everything right. But appetite suppression can hide a bad routine. Someone can feel proudly in control while taking in too little protein and too little fluid. That same person may also be taking in too little total energy to stay steady through the day. Sometimes the drug is working strongly, but the person is still relying on hunger the way they used to. That can become a problem because hunger is now a less reliable signal. The body still needs food and fluid even when the appetite feels unusually quiet. It often feels random even when the pattern has been building for a day or two. You may blame the injection day, but the setup may have started 1 or 2 days earlier. A little nausea, one skipped meal, less drinking, poor sleep, hot weather, or extra caffeine can quietly stack together. By the time dizziness appears, the groundwork may already be complete. Another part of the pattern is the rest of your medication list. Blood pressure pills, water pills, insulin, and some diabetes pills can make dizziness more serious. Some of those diabetes pills can also push blood sugar down. In those settings, dizziness is not just an annoying side effect to watch. It can be a clue that blood pressure is running low, sugar is dropping, or the overall treatment plan now needs adjustment. Still, not every dizzy spell should be brushed off as a routine adjustment. Certain warning signs change the picture. Fainting, chest pain, shortness of breath, confusion, severe vomiting, black stools, severe weakness, or trouble speaking are not mild side effects. Those need urgent medical attention, not home troubleshooting. Another warning pattern is less dramatic but still important. Repeated dizziness with a fast heartbeat, very dark urine, or repeated vomiting can point to more serious dehydration. Dizziness that continues even while sitting is also different from a quick lightheaded spell after standing. The pattern and the intensity matter more than the single word dizzy. If you do not have red flags, the next step is not the side effect list. The better question is what your body actually got over the last day. Count how much you drank, ate, and how much protein, salt, and caffeine you got. Also, ask whether vomiting, diarrhea, sweating, or heat made things worse. That is where the answer usually starts. If that quick self-check points to a mild pattern, start with basics before you assume the drug itself is the whole answer. Sit down, sip fluids, then take in something small that gives calories and is easier on the stomach. Yogurt, soup, crackers with peanut butter, or half a sandwich all work. Then match the symptom to the pattern. If it hits after standing, think first about fluid, salt, intake, and blood pressure. If it comes with sweating, shaking, or a long gap without food, think more seriously about blood sugar. That matters even more if you use insulin or diabetes pills that can push blood sugar down. One mistake is trying to push through the spell because it seems minor. People keep driving, showering, working, or walking, then suddenly feel much worse. Mild dizziness is the point where you stop the problem early. It is not the point where you test how much discomfort you can ignore. If the pattern is still unclear, another useful step is to track timing instead of relying on memory. Write down the shot day, meal timing, fluids, symptoms, and whether standing made them worse. That simple pattern check often reveals more than a vague description ever does. It helps separate a random feeling from a repeatable pattern in your body. Prevention usually comes down to steady habits, not dramatic fixes. Eat on purpose, not only by hunger. Smaller meals, regular protein, and steady fluids often work better than waiting for appetite to return. Once these drugs start working well, hunger is no longer a reliable guide. A planned routine works better than waiting to feel hungry or thirsty. Dose changes also matter. If dizziness begins after moving up a dose, look at what changed in real life, not just the number on the pen. Eating less, drinking less, nausea, and faster weight loss usually tell you more than the label alone. Heat, stomach bugs, and vomiting can turn a manageable dose into a rough week. That does not always mean the drug itself suddenly became more dangerous. Often it means you have less room for missed fluids and missed meals. The same amount of fluid and food that worked before may not be enough once illness or heat enters the picture. The main takeaway is straightforward. Dizziness on these drugs means the body is short on fluid, fuel, or both, not that something serious is going wrong, but repeated episodes, low blood sugar, or red flag symptoms belong in a different category. That is when you stop treating it like a minor side effect and get medical help. Medicine simplified. That's what this channel does. If you want more, hit subscribe. This is not medical advice. Consult your doctor.